we realised that there was actually an inconsistent offer of health and wellbeing for our patients. So some of our tumour groups were quite far in advance in setting up programmes, others were a bit kind of less proactive, and some people weren't actually being invited to the health and wellbeing events that we had offered. So we wanted to do a review of the offer and actually to devise a health and wellbeing programme that would cater for every patient diagnosed in Calderdale and Huddersfield. I think our patients feel listened to because we've consulted with them. So basically, when we'd got our own plans for health and wellbeing, we formed a cancer patient focus group and we asked them what they wanted. We talked to them about our plans. So for example, we talked to them about health and wellbeing events at the end of treatment, and the patient said that was really good information, really helpful, empowering, but actually they wanted that at the beginning. So that's why we've revised our plans now, and we're going to do health and wellbeing sessions, a new First Steps cancer programme at Calderdale and Huddersfield, and we're doing that in response to patient feedback. So I think that's really empowering for the patients, that actually they feel that as a trust we're listening, and we're actually inviting them to be part of that. So our patient focus group are coming to our First Steps programme to give them their feedback. The challenge really is about doing a lot of change quite close together. So we're introducing a new programme on diagnosis to get support in terms of health and wellbeing for every newly diagnosed patient. We're also doing Thinking Ahead, which is a programme for people at the end of treatment. So I think there's a lot of change that people are kind of struggling to cope with and know quite what's going on and what our plans are. So that's probably been the biggest challenge, is actually keeping people engaged and on board and informed so that they know what's happening when, and so that the teams know that they need to be inviting their patients basically. I think a top tip is engaging with the clinical teams. So Christopher Button, who's our lead cancer nurse, and we met with all of the CNSs to discuss health and wellbeing, to discuss what our plans were, to talk to them about what first steps would be and would look like, to talk to them about thinking ahead. So that's been really good that the clinical leads in terms of the CNS teams have gone back to their other CNS teams and actually the CNS members and talked to them about what's happening and who they need to invite when. So that's really important actually, to get your clinical teams on board. We might still be working on our doctors a little bit, who are very busy, but hopefully it's about promoting what we're doing so that every patient can have access to that really high quality health and wellbeing offer.